Have you ever stood at the urinal and noticed your stream just isn't what it used to be? Maybe it's weaker, maybe it splits into two, causing a mess you never used to have. Or perhaps in the bedroom, you've experienced a sudden, bewildering inability to get or maintain an erection, even though you feel aroused. You lie there, your mind racing, asking yourself one terrifying question: Is this it? Is this the beginning of the end for me as a man? If that fear has ever kept you up at night, I want you to know two things right now. First, you are not alone. Millions of men face this. And second, what you're experiencing is very often treatable and, more importantly, reversible. My name is Dr. Evelyn Hart, and I'm a urologist. In this video, we're going to cut through the noise, debunk the internet myths, and give you the real medical facts about your urinary and sexual health. If you're ready to take back control, I need you to do one thing for me. Hit that subscribe button and like this video. This is your channel for honest men's health advice, and I don't want you to miss a thing. Welcome, gentlemen. As I said, I'm Dr. Evelyn Hart. For over 15 years, I've dedicated my practice exclusively to men's health. I've sat across from thousands of men, from 18-year-olds paralyzed with anxiety to 80-year-olds seeking to maintain their vitality. I've heard every concern, every whispered fear, and I've seen the profound relief that comes when we replace that fear with understanding. The reason I wanted to make this video is that the internet is filled with dangerous half-truths and outright lies about men's bodies, especially when it comes to performance and function. Today, we're tackling two of the most common and most misunderstood issues I see in my clinic: the so-called perfect porn star urination stream and a condition called psychogenic erectile dysfunction. We're going to talk about what's normal, what's not, and most importantly, what you can do about it. Let's start with the big split stream. You've seen it in adult films, a powerful, single, laser-focused stream. And then you look at your own, which might spray, split, or dribble. Your first thought might be, what's wrong with me? The truth is, the porn star stream is often as realistic as the rest of the scene. Medically, a single solid stream is a sign of a clear, unobstructed urethra, the tube that carries urine from your bladder out of your body. A split or sprayed stream, which we call urinary bifurcation, is usually caused by a simple mechanical issue. Think of your urethra like a garden hose. If you put your thumb over the end, you change the stream, right? Similarly, if the opening of your penis, the meatus, has a small irregularity, like a skin tag, a minor scar from an old, unnoticed infection, or a congenital issue, it can disrupt the laminar flow of the urine, causing it to split. Now, the more significant cause, especially for men over 40, is an enlarged prostate or benign prostatic hyperplasia, BPH. Your prostate surrounds your urethra. As it grows, it can squeeze that tube, changing the force and shape of your stream. So, a split stream isn't necessarily a sign of weakness. It's often a sign of a simple anatomical or age-related change. So, when should you be concerned? If a split stream is a new, persistent issue accompanied by other symptoms, like straining to urinate, a weak flow, a feeling that your bladder isn't fully empty, or getting up multiple times a night, that's your body sending you a signal. It's time to see a urologist. It is almost never an emergency, but it is a quality of life issue we can absolutely help with. Treatments range from simple office procedures to reshape the meatus, to medications for an enlarged prostate, to minimally invasive therapies. The goal isn't to look like a porn star. The goal is to have healthy, comfortable, and controlled urination. Now, let's move to a topic that causes even more anxiety: erectile dysfunction, specifically the kind that originates not in your body, but in your mind. This is psychogenic ED. An erection is a complex neurological and vascular event. It starts with a thought, a feeling, a sensation. Your brain sends signals down your spinal cord, telling the arteries in your penis to relax and open wide, allowing blood to rush in and create that firm erection. Psychogenic ED occurs when your brain sends the opposite signals. Instead of green light, it sends red light. And the biggest red light of all is anxiety, performance anxiety, the fear of not being able to perform. It becomes a vicious, self-fulfilling prophecy. You worry you might fail, so your body releases stress hormones like adrenaline. which constrict those very blood vessels you need to open up. The erection doesn't happen, which confirms your fear, making you even more anxious for next time. Let me tell you a story about a patient I'll call Mark. Mark was a healthy 28-year-old. He came into my office ashamed, convinced he had a serious physical problem. He'd had one episode where he'd had too much to drink and couldn't get an erection. It happened once. But the next time he was with his partner, all he could think about was, don't let it happen again. And of course it did. His mind had taken a single, isolated event and turned it into a monster. Mark had classic psychogenic ED. He could get erections perfectly fine on his own in the morning, but the moment he felt the pressure to perform, his mind would shut it down. So, how do we break the cycle? First, we rule out physical causes with a thorough checkup. But the treatment for psychogenic ED isn't always a pill. It's about retraining your brain. This can involve cognitive behavioral therapy, CBT, to identify and challenge the negative thought patterns, mindfulness and stress reduction to calm the nervous system, open communication with your partner, taking the pressure off performance and focusing on intimacy. And sometimes we do use medications like PDE5 inhibitors, e.g. Viagra, Cialis, not as a permanent crutch, but as a bridge to restore confidence and break the cycle of failure. The key takeaway is this: your sexual health is inextricably linked to your mental health. There is no shame in this. Acknowledging the psychological component is not a sign of weakness. It's the first, bravest step toward reclaiming your power. Gentlemen, we've covered a lot today. From the mechanics of your urinary stream to the profound connection between your mind and your sexual health. I hope this has demystified some of the things that may have been causing you silent worry. Your body is always talking to you. A change in your stream, a shift in your erectile function. These are not judgments on your masculinity. They are data points. They are invitations to pay closer attention, to invest in the one body you have. My call to action for you today is twofold. First, for your health. If anything we discussed today resonates with you, please do not suffer in silence. Schedule an appointment with your primary care doctor or a urologist. Be honest about what you're experiencing. We have heard it all, and our only goal is to help you. And second, for this community. If you found this video helpful, if it gave you clarity or took a weight off your shoulders, then please like this video, subscribe to the channel, and share it with a friend. You never know who else is struggling with the same fears. Let's break the stigma around men's health together. Thank you for watching and for taking this step for your health. I'm Dr. Evelyn Hart. Stay strong.